Holistic health looks at the whole well-being of the person. We will review a specific dimension of holistic health, looking at mental and emotional health among women. Gender differences are seen among the statistics of depression and anxiety disorders. According to the World Health Organization, depression is more common among females, that is 5.1%, compared to 3.6% in males. These results reveal the need for greater mental support among the female community. Holistic aromatherapy uses the chemicals in essential oils to treat the person as a whole. It considers the energetic and emotional effects that each oil contains. Essential oils are the volatile oils extracted from plants, meaning the oils vaporize easily. These oils contain complex and concentrated chemicals. One oil has multiple active chemicals and acts on many body systems at one time, including the part of the brain that controls mood. Essential oils are absorbed into the bloodstream from the lungs through inhalation or absorption through the pores of the skin. Holistic aromatherapy also depends on the role of olfaction in regards to emotion and memory. The nose contains 5 million smell-sensing cells that allow people to consciously register each smell. Every cell has 6 to 12 hair-like receptors, called cilia, that hang down into the stream of air that's rushing into the nose. These olfactory receptors are the only sensory pathways that open directly to the brain. The cilia detect scents, and the nerve cells relay this information directly to different parts of the brain. The amygdala of the limbic system, which stores and releases emotional memories, is most sensitive to aromas and can induce positive or negative feelings. Odors also stimulate the pituitary gland and the hypothalamus and impact the production of hormones, with increased release of endorphins and neurotransmitters. Alicia was given a list of basic emotions and asked to identify any that the aroma caused her to feel. She was instructed to inhale the essential oil deeply, at least 3 times.
This one also has like a calming, but also like joy kind of. I have an image of swirling, but this is Lang Lang 3. But also that's the smell. That's the scent of my shower spray that I spray after I get out of the shower. So it's like very. But I think there's something in my childhood. Someone used Lang Lang a lot because it's a very nostalgic. Like I can't pinpoint it to a specific memory, but I pinpoint it to being young and to being just like it's like the scent that you smell like when someone, like a mother or someone who cares for you, pulls you close to their bosom, and you're like smelling it in their hair, or on their shirt, or in their neck. It's something very calming about it.
Thank you.
Yeah.
One systemic review looked at 20 years of studies from 1990 to 2010. The review evaluated the anxiolytic effects of aromatherapy for people with anxiety symptoms. More than half the studies indicated positive effects of aromatherapy, and no adverse effects were seen. The review concluded that aromatherapy could be applied as a complementary therapy for people with anxiety symptoms. A 2017 study was conducted on 87 different women who were undergoing image-guided breast biopsy. 2 experimental blends were made with fractionated coconut oil mixed with lavender and sandalwood, or orange and peppermint. They were compared with fractionated coconut oil only, which has no aroma and served as a placebo. Anxiety was self-reported before and after undergoing a breast biopsy using the Spielberger State Anxiety Inventory Scale. The study concluded that a blend of lavender and sandalwood effectively reduced anxiety more than the orange and peppermint blend, or the placebo. A 2015 study looked at anxiety reduction through the use of aromatherapy in post-operative breast cancer patients. These 15 women had all gone through a double mastectomy. They received an aromatherapy massage using a blend of bergamot and clary sage essential oils, diluted in grapeseed oil. The women were interviewed after the massage and the results were recorded. The pampering experience was associated with physical needs being addressed for comfort, and the surrounding ambiance and gentle touch conveyed care to the body and soul, leading to greater peace of mind among the women. Significantly decreased anxiety levels were self-reported after the massage. A study carried out in Iran during 2012 looked at 100 women who were in labor with their first child. The women were randomly assigned to two groups of equal size. One experimental group used geranium essential oil, and a control or placebo group used an oil with no aroma. Anxiety levels were measured using the Spielberger questionnaire before and after the intervention. The results demonstrated a significant decrease in anxiety levels, as well as diastolic blood pressure levels after inhalation of the geranium essential oil. Finally, a 2017 study investigated the effects of aroma inhalation and depression in 50 high-risk hospitalized pregnant women. 25 women were selected for the experimental group, while the other half were assigned to a control group. Neroli essential oil was used for the aromatherapy and was already identified as not being hazardous to pregnant women. The participants inhaled neroli essential oil directly for a period of 2 minutes 3 times a day. Self-reported levels of depression were shown to decline significantly in the experimental group. There are essential oils that are indicated for specific mental health conditions. An essential oil blend is an effective way to apply essential oils to the body. Always dilute essential oils with an organic carrier oil, such as sweet almond, to avoid skin reactions. Essential oils are too concentrated to be applied without dilution. Many essential oils have safety precautions that are not commonly known or labeled. Working with a professional will maximize the safety and efficacy of your aromatherapy treatments. Nationally recognized aromatherapist Salvatore Battaglia explains how holistic aromatherapy depends on the therapist-client relationship. An important part of the healing process comes from having somebody to talk to, somebody who can listen and respond to you. It's also about having a hands-on treatment and engaging in your own well-being.